In clinical pharmacology, a single molecule is typically engineered to solve a single problem. But one specific compound routinely treats a failing reproductive system, an obstructed urinary tract, and life-threatening stress on the human heart. That molecule is Tadalafil, manufactured by Square Pharmaceuticals under the brand name Intimate. It is formulated into a precise set of dosages, 2.5, 5, 10, and 20 milligrams. Clinicians prescribe these exact same tablets to treat the symptoms of erectile dysfunction, benign prostatic hyperplasia, and pulmonary arterial hypertension. These three conditions are anatomically isolated from one another. They affect the reproductive, urinary, and cardiopulmonary systems entirely independently. Tadalafil achieves this by locating and disabling one specific enzyme that governs muscle tension across these three distinct systems. That target is an enzyme known as phosphodiesterase type 5, or PDE5. PDE5 is not distributed randomly. It is densely concentrated within the smooth muscle cells that line specific blood vessels and tissue beds. In a healthy state, PDE5 acts as a strict regulator. It actively breaks down intracellular signals to restrict vasodilation, forcing those smooth muscle tissues to remain tightly contracted. By chemically neutralizing this single enzyme, Tadalafil rapidly forces the surrounding tissue to undergo a localized structural change. The clinical efficacy of this drug across all three organ systems relies entirely on this one mechanism, blocking PDE5 to force smooth muscle relaxation. This diagram reveals the cellular mechanism. PDE5 actively breaks down cGMP, locking smooth muscle into a contracted state. When Tadalafil enters, it binds to PDE5, neutralizing it. cGMP signals rapidly accumulate, forcing muscle fibers to relax. The blood vessel expands, allowing massive blood flow. This specific mechanical chain reaction, inhibiting PDE5 to trigger smooth muscle relaxation, is the cellular sequence that defines Tadalafil's clinical profile. The final clinical outcome depends entirely on which specific anatomical tissue bed the prescriber is targeting. Understanding this localized cellular baseline allows us to decode Tadalafil's most recognized clinical application, erectile dysfunction. Clinically, erectile dysfunction is defined as an impairment in achieving adequate erection duration and physical rigidity. It is frequently driven by systemic comorbidities that degrade vascular health, like severe hypertension, chronic diabetes mellitus, clinical obesity issues, and high cholesterol. This anatomical cross-section illustrates the corpus cavernosum of the penis. Here, the exact same cellular vasodilation mechanism we established takes place, triggering localized blood pooling. By chemically sustaining this massive blood flow, the drug directly resolves the physical symptoms of ED, providing reliable sexual stability. Unlike similar medications in its class, Tadalafil offers a distinct pharmacokinetic advantage, an extended clinical efficacy window. A single isolated dose is rapidly absorbed and remains clinically active in the human body for up to 36 hours. This detailed clinical flowchart formally outlines the two distinct dosing protocols for ED, separated by patient lifestyle and severity. The first pathway is on demand, requiring 10 milligrams 30 minutes prior to activity. The second pathway is steady state, requiring a 2.5 milligram dose taken daily at a specific time. Treating ED is a direct application of the foundational vasodilation model, isolated specifically to reproductive tissue. Shifting focus from the reproductive system to the lower urinary tract, the exact same molecule addresses benign prostatic hyperplasia, or BPH. BPH is an age-related pathology where the prostate gland physically enlarges, constricting and totally choking the urinary tract, creating the obstruction. This mechanical obstruction causes severe clinical symptoms, like severe urinary retention, pain during urination, a notably weak stream, and incomplete bladder emptying. This model demonstrates an enlarged prostate pinching the urethra, restricting flow. Crucially, the bladder neck and prostate contain high concentrations of PDE5. When Tadalafil targets this PDE5, the surrounding smooth muscle relaxes, physically widening the passage and restoring normal fluid flow. While treating ED requires vasodilation to pool blood, treating BPH utilizes the exact same tissue relaxation to widen a mechanical passage. To maintain this urethral dilation over time, the required clinical dosage is 5 milligrams administered daily. A mechanism designed to increase vascular blood flow is perfectly repurposed to clear mechanical urinary obstruction. In the cardiopulmonary system, this exact same enzyme targeting addresses Tadalafil's most severe and life-threatening indication, pulmonary arterial hypertension. PAH occurs when lung vasculature becomes abnormally constricted, causing dangerously high pressure within the pulmonary arteries. This stricture prevents blood from flowing easily into the lungs, leading to severe right heart strain, reduced systemic oxygenation, and eventual heart failure. This diagram maps the pulmonary vascular network connected to the heart. When Tadalafil inhibits PDE5 specifically within these vessels, it forces widespread pulmonary relaxation. This specifically targeted dilation massively reduces the pressure gradient across the lungs, allowing the struggling heart to pump freely again. This comparative bar chart maps the scale of dosing required for this specific pathology. The initial steady-state ED dose of 2.5 milligrams is shown here, alongside the massive 40 milligram daily dose required for PAH. PAH requires this 40 milligram daily dose, administered at a strict, specific time to ensure the pulmonary vessels remain adequately dilated. The immense scale and severity of pulmonary hypertension dictates the scale of the dose, pushing the drug's vasodilatory mechanism to its maximum therapeutic limit. Chemically altering systemic vascular tone is a high-risk medical intervention, carrying inherent physiological dangers. This systemic blood pressure gauge illustrates an absolute life-threatening contraindication: concurrent use of Tadalafil with nitrate medications, which are often prescribed for angina. When these compounding vasodilators are combined, they cause severe, uncontrollable, and potentially fatal systemic hypotension. Strict pre-existing cardiovascular limits also preclude the use of Tadalafil. Patients with a recent history of myocardial infarction or stroke cannot safely tolerate the resulting vascular shifts. Furthermore, severe hepatic or renal failure prevents the body from safely metabolizing and clearing the medication. Therapeutic vasodilation is a delicate biological balancing act that quickly becomes lethal if the body's systemic physiological boundaries are crossed. Even when safely prescribed, patients expect specific, non-lethal side effects when peripheral vasodilation escapes the target tissues. Common systemic reactions include headaches, muscle pain known as myalgia, and generalized weakness. Localized mucosal effects frequently occur, resulting in nasal congestion and dyspepsia, or indigestion. These side effects are simply the unintended consequences of PDE5 inhibition temporarily relaxing smooth muscle in non-target areas of the body. Tadalafil's clinical utility is derived from its precise, singular targeting of the PDE5 enzyme, a mechanism that allows for the manipulation of 3 different anatomical systems. This exact pharmacological versatility is why the medication demands rigorous clinical oversight, ensuring the precise dosage perfectly matches the patient's unique pathology.